Good morning, everyone. Good morning, good morning. Good to see such a packed Azalea room this Tuesday morning. We're going to start. Thank you all for being here. Also, thank you for our online participants for joining. I understand it's a bit difficult for the online people to properly engage with us during the session, but we have some online team members as well who will make sure your questions and your comments get to us. So thank you for being here as well. All right, my name is Jesse Reimagining. I'm a researcher. I'm working at the Dutch National Institute for Public Health and the Environment. I'm joined here today by my colleague Jerome, sitting here up front, and a number of very inspiring speakers from all over the world, both here in person as well as online. And we're here today to engage with you on the subject of water quality and health in climate change, adaptation, policy, and action. When I say climate change adaptation, of course, we're thinking about adaptation in the wash sector, but I think in this session we'll also like to extend that a little bit and talk about climate change adaptation in the field of water management, and maybe even think beyond that. So generally, climate change adaptation, we're using water increasingly as a tool to adapt to climate change, to make our living environment and ourselves more resilient against the effects of climate change, like flooding or heavy rainfall or extreme temperatures. And we as an institute have quite a lot of experience working on water quality and health in relation to climate change adaptation, both in the Netherlands as well as internationally, for example, through our work on climate resilient water safety planning, amongst other things. And we've been reasonably successful, but we've also encountered quite a lot of challenges trying to connect these domains, connecting water quality to health, to climate change adaptation. And when we look at the policies and the frameworks that we have in place to adapt to climate change, for example, in the Netherlands, it's not very surprising why this is such a challenge. So in the Netherlands, we have a lot of water. We have a long history of trying to manage that water as well, now also in the context of climate change. But when we look at the way that we talk about water in our climate change adaptation policies, it's almost all about quantities. So do we have enough water? Do we have too little? Is it in the right place? These are the kinds of questions that we're trying to address through our adaptation policies. But when you're a stakeholder working to adapt to climate change and you're looking at these policies and these frameworks for guidance, and there's nothing about water quality in these texts, then it's not a surprise that it won't be at the top of your mind when you're adapting to climate change. So what we're hoping to do today in the session is to change that for you, for the people here today, to put water quality and health at the top of your mind when you're thinking about climate change, and to give you a little bit more tools, or at least a little bit of insight to make you better advocates to do this as well in your own field, in your own work. So to do this, we have a pretty diverse schedule. We're starting the first part of the session, and this is also the part where we can engage with the online audience. We have speakers. We have 6 speakers, and we have split them up into 2 groups. So we will hear from very diverse backgrounds, from the wash sector, but also from water management, from government, about research funding, and then we'll go into the actual research projects that are working to figure out this issue and to actually implement it in the field as well. And then we'll move to the interactive part of the session. We're going to play a game, and we'll explain that after our presentation. So Bruce is already looking at the card, so yeah, this is what is in store for you. So great schedule today. I'm just going to move to the first 3 speakers, our policy and financing sector. I hope they will introduce themselves, but here they are on screen as well. So we have Bruce and Jerome here in the room with us, and then Nika coming to us from Tbilisi in Georgia to talk about their own national perspective. So Bruce, please start with your presentation.
Okay, thanks so much. Good morning, everyone. I am waking up slowly, so you can enjoy waking up with me. But I wanted to give you just a brief overview of some of the interrelationships of climate change, water quality, and WHO, kind of how we're addressing it. And I think the first thing to note is that climate change has been identified as the greatest public health threat facing humankind, and it's first on WHO's priority. So when we look at the new WHO strategy, which we call the Global Program of Work, climate change and health is at the center of that, and which is kind of actually surprising, because when we think about environment, environmental determinants, things like even specifically water quality. It's typically lower on the agenda of an agency that is focused on medicine and pandemics and these kind of issues that are more associated with health. But of course, yes, water quality. I agree with you. It's one of these things that we don't think about it so much, yet when one thinks about things like wildfires, incredible amount of organic content going into the water. We think about some of the even cyanobacteria that we see, I think in your photo before. You see this stuff from outer space, salinization, all these issues. There's a tremendous amount of impacts from water quality. And it's all framed. It's hard to, I agree, it's hard to kind of, when you think about some of the headlines about the amount of excess deaths that are being caused, the fact that when we think about climate change in general, it's actually impacting on the very systems and structures that allow us to manage water better. So yes, it's all this sort of interesting and complex circularity. I mean, you can have water operators that can't get to work, for instance, and we see, just think about the pandemic when all the issues around people being locked down impacted, various services, including water supply. So it's a difficult one to face, and there's a pretty, I would say, important research agenda associated with this. Because there just definitely needs to be, I think, more studies, and there's particularly few around some of these impacts that we're seeing, or that we may be seeing on pipe systems. I know rainfall is obviously one where everyone knows that the quality of water deteriorates and diarrhea increases, but it's going to get worse, and will keep getting worse. So we have some tools that we've been dealing with for over decades that have been addressing this, and you're familiar hopefully with some of them, the water safety plans and sanitation safety plans. And all our guidance now is through the lens of climate resilience, so that when we have issued new updated guidance, we're addressing these. And there's some pretty big issues when you dig into it, because ultimately a water safety plan is something where the water suppliers themselves need to take on the responsibility of doing risk assessments. But it's a lot to ask a water supplier to start trying to understand really complex information around meteorological information, and patterns of climate change. So we say there should be climate experts on the team that does the risk assessment. There should be some interfacing with water resource management and the sort of more narrow wash kind of risks that you face. But ultimately that is very difficult, and we've seen really interesting examples, notably in Ethiopia, where there was a ton of information about where there's drought, where there's more increased rainfall, and the ability of the water supplier to interface with that information and actually influence risk assessments has been difficult. So the other thing I thought would be interesting just to share, as far as a big initiative of WHO and UNICEF, in particular through the Joint Monitoring Program, GLASS, is efforts to define and measure climate resilience around the world. So we've been asked, okay, like what broadly, how many, what's the extent of water services and sanitation services that are climate resilient? That's the basic question, and people would love to have a binary answer, and we could say X amount. And but what's we've found is that as you dive into this, there's no common definition. There's a lot of confusion about whether we mean a governance system, like do you have policies and programs and all these things where climate is kind of integrated, or do you actually mean infrastructure, like do you have the raised garden, do you have latrines that could flood and so on. And it's really, really complex. So we're trying to do quite a thorough review of that, and I think there's another session that will be looking at that. But ultimately, that will be informing the progress on the global goal of adaptation, which has as a first priority to increase adaptation and resilience to wash. So yeah, and of course, an indicator that may not necessarily be, how do I say, potentially credible or workable at the global level is to what extent are water suppliers putting in water safety plans or some sort of risk management with climate change integrated in. So this is my final slide, but I just wanted to say that, where is WHO going? How does it all fit together here? I mentioned the monitoring, I mentioned the integration. We have a big push with our health colleagues on trying to ensure that healthcare facilities are resilient, including WASH, but the biggest piece of WHO's policy here is having climate resilient healthcare facilities generally, so providing health services. So that means things like energy and resistance to the extreme weather events and things like that. So the health facility needs to keep going, and WASH is a big part of that. There's other issues I think that are quite interesting. The whole issue of environmental and wastewater surveillance, very potentially in the forecasting, the early warning. So how can we get clues to what extent that there will be health risks that would be related to climate? Controlling the spread of vector-borne diseases, that's another big one, completely neglected. I don't know if there's any topics on this conference, tell me if I'm wrong, but we've had a lot of concern about invasive malaria, for instance, going from South Asia to Africa, so Anopheles stevensii, and how it may breed in very much like dengue, which is another big concern. But WASH measures are those that are needed to contain it, right? So it's not just through insecticide-treated bed nets. But yeah, the biggest, I think some of these big things, I mean, yeah, they make sense to us, but I was even just having a discussion outside, are we having a WASH conference here? In a few years, we'll be having a WASH and Integrated Water Resource Management conference because, are we doing ourselves a disservice to be focusing on WASH? And so we need to bring those together in the UN system and obviously with practitioners. So anyway, I think a lot of exciting things, both very specific on water quality, but big and broad. And so we've got to take a deep breath and address it because this is where our sector is going, this is where the funding will go, this is where we're going to be sort of situated. All work is going to be kind of under this climate lens in many ways. So, but thanks for the opportunity. I wanted to just say how important RIVM is as a partner of WHO, and we really rely on them for their expertise in so many ways. So thank you for having us on the panel, and thanks to all of you for being here so early.
All right, we'll have a little mini panel discussion at the end of the first section, so then there's opportunity for you to ask questions as well. We're now moving to want to share this as well?
Oh, yes, sorry. That's what happens. I should acknowledge I have Jennifer de France and others doing my slides. But we do have an addendum to our strategy. So this is online, and we'll give you the latest update of what WHO's directions are. I summarized them in a few bullet points, but that's a document of about 10 pages long that will allow you to understand what some of the research priorities are and how we're trying to tackle the issue. Thank you.
All right, thanks. So we're now moving to our next speaker, who is online and in Georgia. So I will pull up the camera here. I hope it won't block the content, otherwise I'll move it around. But yeah, I think Mika's talk will tie into Luce's last point, especially about the integrated water resource management. So giving you a little bit of a perspective on that aspect of the issue as well. So Nika, you can go ahead.
Many thanks, dear Jesse. I'm gonna speak from the perspective of policy reform, which took place in Georgia last year. Firstly, I'm going to represent myself. I'm Nika Gogatishvili. I'm representing Ministry of Environmental Protection and Agriculture of Georgia, and I am a senior specialist of Water Division. Water sector is one of the historically one of the most deregulated field in Georgia. After collapse of Soviet Union, monitoring and control and supervision over over water in Georgia was a really problematic issue. It was not only about administrative capacity, but it was also about lack of expertise and knowledge. One of the main issues that the previous law was not addressing the current issues and problems which are impacted by climate change. And one of the main reason why the new law was adopted in Georgia is because it's the older one, which was adopted in the late 90s, was not actual and was not addressing the real-time issues in Georgia. And after this, also a really important thing happened in Georgia, which was actually connected to association agreement with EU and Georgia. And in this regard, Georgia took some obligations in order to implement EU framework directive in its national legislation. And now Georgia has transformed into the river basin management system, which is really new model in our country. And the management and integrated water resource management principles are kind of fresh for Georgian context. From the policy perspective, this part was kind of really difficult because a lot of sectors are connected to water resources management, not only energetic or economic, but also health, which is one of the most mainstreaming area in this discussion. And I would like to say that after the water reform, many normative acts and amendments have been done in the regard of health and water sector, which was one of the main area of our interest, because like health is really important, and water reform addressed to health sector. I'm going to show you shortly basin territorial units as our new law emphasized and delineated the territorial units of river basin management districts. And one of the main challenges that Georgia is facing today, it is climate change. For a little bit context, as you might know, Georgia is a mountainous country in the south of the Caucasus, and there are a lot of mountains, and basically the rivers are coming from the glacier melting, which is kind of really big problem in this regard, because like after and in the context of climate change, rivers are getting really without control, which is hard in this context. And not only the pollution and not only the management is the problem in this regard, but also the monitoring and using and utilizing water resources from rivers and lakes. Another important issue in Georgia, which our reform was addressing, is water accounting and economic mechanisms. In the better scenario, Georgia should keep the economic mechanisms water revenue, but after the collapse of Soviet Union, many of those regulations have been abolished, which was really a big problem. For the next slide, I'm gonna show you mostly the monitoring and yes, thanks, Jesse. Monitoring and water quality status in Georgia. As I mentioned, AA agreement between Georgia and European Union has defined main obligations in this regard, and Georgia has changed its water body status like a scale, and as well as by many supports by international projects and programs. Our country has developed monitoring program, and now mainly the monitoring is fully in line with the Water Framework Directive obligations. Beside of this, one of the programs was about nitrification, which nitrification actually is not really a big issue for Georgia for this moment, but as the use of nitrates is rising so rapidly in Georgia, from this point of view, we also perceive that the issue is getting more and more actual for this context. So to synthesize this knowledge and information, actuality and importance of monitoring and development of monitoring network of groundwater and surface water in Georgia is really important. And beside of this, nitrification is gradually increasing issue in Georgia. I would like also to point out some challenges, and as I have mentioned already many times, yeah, glacier melting and water pollution is one of the biggest issue, which is really important, and our reform is trying to address this issue. And some of the disasters, floods, and many catastrophes are also connected to these parts, which is really coming from the climate change impact. And one of the biggest issue also we are facing nowadays is untreated wastewater, which is really big problem because many big towns in Georgia, some urban wastewater treatment plants are not really in a good condition, which causes really big issue in this regard. And as I mentioned, agricultural diffuse and runoffs in water is kind of increasing problem in this regard as well. And since Georgia has also some industrial and producing, industrial pollution is getting also really problematic in the water resource management field, and some heavy metal contamination and industrial pollution is also a big challenge. But our new law is trying to address all the challenges, and the reform that we are still into this phase. So now we are calling this phase transformation phase in water resources management, because like the law was adopted last year, and this period is like a transformational phase, and it's getting into force gradually. I would like to thank you, dear colleagues, and I'm really sorry for not being in physically with you. And still, I think, yeah, it's that's all that I would like to say, and many thanks for your attention.
Thank you very much. We're going to our next speaker, and that's Jerome.
Nice. Hi, folks. Thanks for the floor, Yasser. Well, I'm working at the RIVM. I'm a scientist in infectious diseases and global health, and increasingly finding myself working in and around the topic of climate change, which, well, as a laboratory-trained scientist working in clinical settings, climate change is quite far away from looking down microscopes and performing PCRs on blood samples. So in this talk, I'm going to shortly, with broad brushstrokes, describe to you a funding mechanism, Horizon Europe, which is supporting the project called Springs. The QR code links to the website, and there are also some communication platforms that we've developed under the project. So in sort of a nutshell, what is Horizon Europe as a funding mechanism? Well, it's the EU's largest research and innovation funding program. It comes after Horizon 2020, and this funding program goes up to 2027. It's got quite a large budget there, 93.5 billion. The project that I am working on with quite some stakeholders and beneficiaries, we were granted 6.5 million from this Horizon Europe mechanism. And our project goes on for 5 years. So the main goal of this mechanism is to drive scientific excellence, and in particular, and which is quite different to Horizon 2020, Horizon Europe puts quite some emphasis on tackling global challenges to promote innovations across Europe, and in particular, that involves climate change as well. So how does this funding mechanism work? Well, they put calls out in work programs, and consortiums can submit proposals, and there's quite a strong selection criteria. It's marked very rigidly for consortiums and their proposals to become accepted. If they are accepted, Horizon Europe then provides grants to beneficiaries and to the consortiums themselves. And it's often the case that the budgets do cover up to 100% of the work that's to be done. So it's quite a significant funding mechanism to promote innovation, research, and collaboration in the European region, but also with partners who are associated with European actors and organizations. So it's probably the case that you're also familiar with Horizon 2020 or Horizon Europe, if you're based in the States or perhaps in African countries or other places around the world, through a relationship that you have with a European organization. So the Horizon Europe funding mechanism, it enables innovation within Europe and further afield in the development of sound science and also cutting-edge technologies. It has a focus to develop programs and projects, as I mentioned, on climate change. There's a big effort on digital innovations as well, but also it promotes and develops solutions that really do benefit societies and communities. And it's primarily focused on the EU organizations and in consortiums that do submit proposals to these funding mechanisms. It's the case that, well, it's necessary to have an EU organization leading, but other organizations from other places in the world can be associated to them. Universities, research centers, private industries and public bodies via the primary European organization that's submitting the grant or the proposal. The Horizon Europe mechanism does promote global collaboration and very much welcomes international cooperation. And it's often the case that for a grant to be given to a consortia, the consortium must have quite some diversity within its membership. So that's, in summary, a broad brushstroke background to what this funding mechanism is. And for our project in particular, for Springs, we submitted a proposal to Horizon Europe under the topic of tackling the effects of climate change on diarrheal diseases. Something that was quite challenging on this is we orientated our project to really be placed at the interface of clinical science and hospitals, the water practitioners, utilities, for example, but also climate and meteorology sectors. So it really crosses boundaries in that sense and really reframes the positioning of water quality and quantity, public health, also burdens of disease in the context of climate change. And that was what Horizon Europe told us was a really strong innovative component of our proposal, which allowed us to be accepted. So that's something that was quite nice to hear. In Springs, we particularly focus on diarrheal disease burdens in under 5-year-olds, and we have evidence that the main drivers for diarrheal disease is unsafe drinking water. We also have evidence that climate-sensitive waterborne infectious diseases in Europe, we understand what they are. And we also have evidence that climate shocks such as drought and flooding do impact water quality and quantity. So a key question that emerged was how climate shocks alter water quality and diarrheal disease trends, and also what we can do to prepare and respond to these risks that may emerge. So ultimately, this project aims to inform the key climate, environment and health adaptation policies. That's sort of the main mechanism that we work on in order to support and prepare citizens, communities and governments by better measuring the impact of future climate shocks on the burden of waterborne diarrheal diseases. We have 4 target pathogens that we're looking at, and we work within 4 case study locations in Africa and also Europe. And we do this to prioritize effective political responses via environmental and health policy development and understanding, and by building case studies in these 4 sites, which do have very diverse and contrasting sets of vulnerabilities. We want to measure and predict the local climate shocks that may be present, also local water quality and local pathogen-specific disease burdens. So when we think about the objectives of the Springs project, well, I mentioned that it's really crossing some boundaries and it's really at the interface of hospitals, of climate and meteorology, but also water sector as well. So we aim to use climate modeling with global to local downscaling methods to study climate and health interactions and build some associations by different modeling approaches to understand the interactions of the two. We will measure and model the impacts of climate extremes on flooding and drought to describe how the diarrheal pathogens that we have chosen, so the 4 target pathogens, how their trends are, and we do this looking at past data, current information, and future modeling, or modeling the data that's present to determine future trends. We also use or we lean in on the social sciences as well, because we also will do participatory ethnography studies to understand the beliefs around climate change, beliefs around water, and also beliefs around diarrheal disease risks in the 4 case study sites that I mentioned. And also identify the existing mitigation and adaptation measures that are present in those case study sites. And maybe tapping into Bruce's presentation, a core element of this project is to implement local water safety plans, which indeed are coming from the guidance that Bruce mentioned in his talk. We're also applying quantitative microbial risk assessment, which is a tool that's coming from our institute at the RIVM in the Netherlands. And we do this by taking water samples from water sources, surface and groundwater, and determining the risks that are present in them. We also conduct economic and health value impact assessments, and that's being performed by the London School of Hygiene and Tropical Medicine. And we do this with stakeholders and policymakers to support the implementation of sustainable policies that can be put in place in environment and health sectors with the robust evidence that does come out from the modeling approaches that are being done under the project, but also by the quantitative data that's being gathered by testing the water. So this is a quick summary of our team. We have 15 partners across Europe, Africa, and the USA. We have diverse skill sets. We have professionals that include the scientists specializing in climate change. We also have scientists who specialize in the environment. We also have health practitioners and clinicians, but also scientists working in the social sciences as well. And altogether, in the organizations that we work in, we collaborate with the communities, with the private sector, with public authorities and policymakers within the case study sites that are chosen under this project. And by building these relations and interfacing between public health, the hospitals, the water sector via utility companies and water authorities, but also the climate scientists and environmental scientists. We then aim to, via supporting policy action, support the reduction of diarrheal disease risks and burdens in under 5-year-olds in the 4 case study sites that I mentioned to you previously. So that's a really broad brushstroke of the European funding mechanism that enables this project, and also a bit of information about what this project is, some parts about its complexity, and also what we ultimately aim to do. So I'll pass it back to Jesse. Thank you.
Yeah, I will pass it back to the speakers because we are in a little bit of discussion session now. So if there's any questions from you to our speakers here, then please let me know. I'll also... Mika, can you turn your camera on, then we can see you. Yeah, perfect. Yes, over there. Oh, maybe I will...
Those to Q&A online.
Yeah.
Yeah, my name is Maureen, and I have been with Jerome, what informed the selection of these study sites?
Could we hear the question online?
So the question was, what informed the selection of the study sites? And well, the main coordinator of the Springs project is the Amsterdam Institute of Global Health. Some of you may have known of them, but it's via their network and the collaborations that they've had over time that key relationships have been built over the years, which has led to the consortium being built. And depending on the skills that were required through the conceptualization process of the proposal, other organizations were brought in and pitched the idea that this project is, and then a determination was then made if they wanted to contribute. So for example, our institute, yes, and mine, the RIVM in the Netherlands, we were brought in quite late because the consortium understood that they really needed strong experts in the implementation of water safety plannings, but also the quantitative microbial risk assessments to be on board. So that was sort of our unique ability that we had as an organization, and there was a clear need for that in the project, which then, well, we understand the value of the project. It is quite innovative between these sectors that I mentioned. So for us, it was a real, it's on our street kind of workflow. So initially, it's via existing connections and working relationships, and then depending on the nature of the project, other organizations are brought in depending on the specific skills and abilities that they have.
Any other audience questions? If not, then I guess we will move on to the next part of the speaker sessions. We have 3 speakers. 2 of them are here with us in person, and Jeremy, who is in Sydney. It's a bit late for him to join us today, so he has pre-recorded a session, and we will hear from him as well. All right, so first I would like to invite Saskia and Dennis to please sit up front. And Mark, you could also. Okay. And Saskia will be the first speaker, so thank you.
Great, thanks, Jesse. Hi, everybody. And hi, everyone on the line as well. Thank you for joining us. So my name is Saskia Novitsky. I'm a research associate in the School of Geography and the Environment at the University of Oxford. We've heard in this previous session a lot about evidence that is informing some of these big policy and structural decisions. So I'm going to give us a little deep dive on a bit of that evidence and talk specifically about intermittent contamination in small water supplies, particularly focusing on fecal contamination risk. So what I'm going to show you in a minute is some results from 2 rounds of analysis on a data set that was collected mostly through 2016 by a World Health Organization project that was funded by the UK Foreign Commonwealth and Development Office. And it took place in Bangladesh, Nepal, and Tanzania, with just over 5,000 samples, E. coli samples, collected from 525 water supplies. These sites were selected purposefully to represent a range of risks, particularly high climate variability. So sites were selected where there had been previous issues with severe water scarcity and flooding, and where weather data were available to be able to allow a comparison with the E. coli results. They were selected across an urbanicity spectrum, so there's rural, peri-urban, and urban sites represented in this, and to capture a diverse array of water supply infrastructure, most of it being improved sources, and then also some unprotected dug wells. So the way that the sampling design worked was samples were collected on a more or less monthly basis at each water point over the course of about a year. And so some recent analysis done by an MSc student that we've been working with, Rafaela Betts, she did a sequence analysis on this data set. and found that water supplies with E. coli detected at least once during that sampling period were very prevalent. So they made up the majority of the supplies. But there were very few, so less than 5% of the water supplies in any of the countries was contaminated all of the time. So basically the headline point from that being that the majority of these supplies are intermittently contaminated. It's difficult to predict when we're going to be seeing the E. coli or not in these supplies. So with this analysis, we did see extreme weather, rainfall and temperature both were driving the likelihood of finding E. coli. But in a way that's very difficult to find a pattern out of or to predict. So there were interaction effects between extreme rainfall and extreme temperatures that had different influence on the likelihood of contamination in the different sites. Even within the same country, sub-locations of where the data were collected, you're not always seeing the same effects of these extremes. So the contaminated water supplies almost all had a unique sequence of contamination. So that's like, the pattern of whether there was no E. coli or E. coli at different risk levels was unique for almost every water supply, making it really, really difficult to predict when is your optimal sampling period. Having said that, we can still see in this data that the timing of sampling has a strong influence on the likelihood of detecting E. coli. So what Rafaela has done is look at if you have one sample that you're taking in a year versus 2, 3, so increasing the number of samples you've got in a year, how likely are you to be finding the vulnerable water supplies? And by vulnerable water supply, I mean a supply that's going to be contaminated at some point during this year. And it really depends when those samples were taken. So if you only have a single sample that you're doing in a year and you collect it during the drier conditions, a drier period, then you have a 20 to 50% likely, or you're going to capture 20 to 50% of the vulnerable supplies in that. If you take that single sample in a wet period, which we all know is a more difficult time to actually be doing sample collection, you are much more likely to pick up vulnerability in the supplies. So 50 to 70% of the supplies could be captured by one sample. If you have just 2 to 3 samples in the year, that can go up to 80 to 90%, depending on when you take the samples. So from all 3 countries, the indication is that if you're only sampling twice in a year, both samples in the rainiest period is going to give you the highest chance of finding your most vulnerable supplies. If you have a 3rd sample, and actually doing that in a drier period is going to give you the best additional likelihood, because you're going to start seeing other contamination pathways that are not related to the extreme rainfall events. So just to come to some takeaways about what we can do with this information. I mean, I think firstly, it's supporting what we're seeing increasing recognition of, that grab sampling is overestimating water safety. So particularly the really high-profile study from Esther Greenwood and colleagues that came out very recently, estimating 4.4 billion people don't have access to safe water. The results here with these bands of kind of likelihood of estimating contamination, we've applied them to the mix survey results. And when you do that, you get similar numbers. So we are, it's sort of confirming that observation that we need to be thinking about this as a much bigger issue in terms of the number of people affected. Another thing that we can take away from this, I think, is the importance of risk-based monitoring. So if your monitoring schedule is reactive to weather, is taking into consideration the climate that you're working in, you could be a lot more efficient than just applying a routine monitoring where you're not really being reactive in terms of when you sample. But of course, as I already said, sampling during the rainiest periods is the most challenging time for field teams to be out there. So perhaps there's a role here for also some of the remote monitoring where we're seeing a lot of innovation in that space. And I think a critical piece of that is, can that monitoring continue through extreme events? And then, of course, it's not all about the monitoring. This information is only useful if it's actually going to help with the operation and maintenance of water supplies, so that we have better water safety as an outcome. And so I've put this picture here of a door, which was all that remained of an elaborate fence around a hand pump at one of the sites where I've worked. And sort of at the time we were going back for monthly sampling, and every time I was there I felt the futility, in a way, of taking another sample when this was the state of the sanitary protection, and there was fecal contamination visible all around the hand pump. So really focusing in on how valuable is the monitoring information to inform sanitary hazard management and implementing treatment. I think we are seeing more and more evidence that for small water supplies to be safe, we need to be actively managing them, and a lot of the time part of that is treatment as well as the hazard protections. But how do you actually get there? I think brings us to this point which came out very strongly in the plenary yesterday, but the role of professionalized operation and maintenance and how important that's going to be in managing water safety, and managing water safety in a way that contributes to climate resilience particularly. So I've got the slide there from the parties at the last COP where they approved the global goal for adaptation, which water and sanitation is a very big priority within that global goal, and the Sanitation and Water for All task force, as Bruce mentioned, now has a normative definition of what is a climate resilient water supply, and the backbone of that is around professionalized operation and maintenance. So just coming back to that idea, I think that we have more and more a strong vision of where we want to go for this, but how we actually get there, what are the steps we take in the journey towards more professionalized operation and maintenance? That's obviously the big questions that we're still grappling with. So I'm hoping we can get to that a bit in the discussion. So I'll stop there. Thank you.
Hi everyone, thanks for joining this session. My name is Jeremy Colis, and I'm presenting this work on behalf of my colleagues at the Institute for Sustainable Futures at the University of Technology Sydney, UNICEF, and Universitas Indonesia. The aim of the project that I'm presenting today was to collect evidence of climate hazard impacts on sanitation and to support local government decision-making in 4 cities in Indonesia. And in particular, we wanted to support local governments to think about how they could implement adaptation responses or policy changes to manage climate change impacts on sanitation, to mitigate the possible negative impacts on public health and detrimental effects on water quality. The project included several steps, including a data collection phase in which we conducted 412 household surveys, several community FGDs and community interviews, and dozens of local government and service provider interviews. And these were carried out in 4 cities in Indonesia: Bekasi, Makassar, East Lombok, and Palu. However, in this presentation, I want to focus on just one part of the project, which was the city climate change response workshops with the local governments in those cities. And in those workshops, we hosted participants from several ministries who had responsibilities relating to sanitation in each location. And in each location, each city, we hosted a workshop in which we presented the results of our findings and supported them to understand different ways they could make adaptations and policy recommendations. And I'll walk through the steps that we followed to conduct each one of those city workshops. So step 1 of the workshop was to present the results of the data collection that we did in their city. We had lots of charts and lots of data to share, and this is just one example of a question that we asked households about what they did when they didn't have enough water to flush their toilets or operate their toilets. And as you can see in this city, a large proportion of people reported reverting to open defecation. After presenting all of the data from the data collection phase, we summarized the key risks that we identified in the research. And here's an example of one city on the left-hand side of risks that we identified. We then asked the participants to consider each one of these risks in terms of its severity, the likelihood that it could happen, and the exposure in terms of how many people would be affected and whether those people would be vulnerable groups. To answer these questions, the participants had to use their own tacit knowledge. Many of the participants had been working in the sanitation sector for years, so they have a lot of experience and judgment that they can draw on. So all the participants who are coming from different ministries were put into groups together and were asked to think about each of these risks in terms of the severity, likelihood, and exposure, and then come to an agreement on a score. Once the participants came to an agreement on a score on a scale of 1 to 5 for that risk, we used a Menti poll and asked them to enter their score into Menti. So each individual group was scoring each risk differently based on what they thought it should be. And this is an example of some of the resulting scores that came out for 5 of the risks that were presented to the group. Just as an illustration, these are the top risks that came out for each of the 4 cities. In Lombok, Timor, they reported that households returning to open defecation when there wasn't enough water to flush the toilets was the #1 risk. In Bekasi, it was that many toilets were becoming flooded when the river overflowed. In Makassar, it was people being physically unable to reach communal toilets when there was too much floodwater. And then finally, in Palu, there was trouble with high sea levels inundating toilets along the coast. We then asked the participants to come up with adaptation actions or policy recommendations to address the top-rated risk in their city. And we provided them with this framework of possible response themes that they could give their suggestions to. This required quite a bit of discussion between the facilitators of the workshop and the participants. It's actually quite difficult to come up with good solutions when someone just asks you cold. So there was a lot of talk about what could be done, examples used from other countries, and the inputs from the expert facilitators, I think, were a necessary piece to support the local government participants to come up with solutions that they thought were relevant for their own cities and that could be implemented in their contexts. Finally, we collected the responses that the participants gave through Menti, and we synthesized the recommendations they had for protecting sanitation from climate hazard impacts so that there would be minimal public health effects and impacts on water quality. We then weaved in our own expert opinions, and we fed that back into the city governments later on through a report. This was all done during times of COVID, so the report back was done virtually. In summary, I want to share 3 key takeaways from this whole process. One is that it was really useful to provide local data and information that we collected so that the decisions that the participants were making about their recommendations were informed by actual evidence. And it was important to have data from each individual city because as you could see from the top risks, they were quite different from city to city. And it was also compelling for the participants. It really made them feel that climate hazards were relevant for sanitation and water quality when we could provide actual empirical evidence. Next, it was really useful to have a simple process to facilitate their engagement with risks. One could come up with a really complicated and nuanced way to do risk assessments, but really there's so many unknowns that it might not even be worthwhile to try to come up with a very sophisticated process. At the end of the day, most of the local government participants only have their own experience to draw on, and that can actually go a long way towards developing useful and meaningful policy recommendations and adaptations. And then finally, the co-production process was really helpful. It's a bit too much to just go to a local city government and ask them cold to come up with solutions to these risks. So it was helpful to have the workshop facilitators who were from universities that were experienced in these areas to work with them and co-produce the recommendations rather than the recommendations just coming from researchers or just coming from local government officials. If you'd like to learn more about the project, you could please see the QR codes on the side. One of them links to a report of the wider research project that I mentioned earlier on, and another links to a journal article which describes the workshop process that I just presented in more detail. Thank you.
Hello, good morning. Yes, so my name is Dennis Munai. I work at AMREF South Africa in Kenya. For those not familiar with AMREF, we work in almost 5 countries in Africa, and we have offices in Northern America. We have offices in Europe, but these are fundraising offices. So I'm going to speak about implementation. So this is literally what public health experts and engineers, water engineers do to also figure out how to walk around climate resilient wash infrastructure. So for background, I'll talk about arid lands in Kenya. So these are places like, so we have counties in Kenya, so we have Narok and Turkana. For context, these are very dry areas, inhabited, and of course with huge geographies. Mostly rains. When it rains only for maybe 2 weeks within the year. Sometimes it rains in, so for example in Turkana it rains in the upper parts of Sudan. But then you feel the effects, the flooding, the flash flooding in Turkana, where there's no rains in the upper parts of in Turkana actually. So so this the photo here is it's a river called Taraj. It's in Kakuma, and this is where most of the boreholes are placed. So Kakuma hosts refugees, and it hosts also refugees from Sudan, and also refugees from and hosts in the local community in Turkana. So most people live in Kakuma. So River Taraj is where most of the boreholes are drilled, and this is where you get most of the water that serves the population in Kakuma. So that photo was taken in around February of this year, and basically it shows the vulnerabilities that. So you have a borehole there. It provides 40 cubic meters per hour, and this is where most of the water comes from, and it's now at a risk of being washed away. So my colleague Martin is here. So this is so he made the presentation, but that's a quote from yeah, there's a name there. But basically, literally, we are saying that heavy precipitation, of course, then you have flooding, then you have soil erosion, and of course, most of the boreholes, most of the shallow wells, hand-dug pumps are washed away. There's always that risk, and of course, toilets collapse. So we took some data from Kakuma Ward, and it tells us that if you can see that photo, there is, of course, an increase in diarrheal incidences, and of course, these are and even wash-related incidences during the flooding season. So in Kenya this year, around February, March, actually no, October to December, it extended to February. So we had what we call the El Nino phenomenon. These are extended rainy season, and we could see over 3 months there was an increase in diarrheal incidences. Also, for context, is that most of the rural communities they don't go to hospitals when they have diarrhea, because hospitals, one, sometimes they are closed, they're very far away, the transportation is a problem, so you always sit it out 2-3 days. And when now it becomes a big problem, that's where you go to the hospital. So of course the report, this is under reported. So that is that for the water-related incidences. So now talking to what we do and how we work with governments and how we try and capacity build governments and even the local NGOs so that they think around how to implement climate resilient wash infrastructure. So so this photo was taken I think 2 weeks ago, and it's a photo on a borehole that we've dug, and of course there's a fencing to ensure that there's water safety. The water safety is also factored in, and that's a photo of how we also, of course, take advantage of the excess sunshine. So most of the time, years ago, we used to do genset generators for the pumps, but now over the years, now we are utilizing solar to not only pump out the water from the ground, but also to install water treatment through reverse osmosis. So of course, this, we work very closely with the governmental officials, with the local NGOs, just trying to also capacity build on how to design solar power, how to design these pumps, how to ensure that there is a proper abstraction, how to, the type of pumps, because we see that usually there are pumps that are a lot more expensive, but then they are longer lasting. And of course, abstract this water in a sustainable manner. So, of course, we also work around decentralizing water governance. Is what I think it's been a recurring theme yesterday and today, and we try and of course capacity build the locals to also manage their water. So these are small. You could call them small, but they are high yielding boreholes. They have a lot of sufficient water, and it's just a matter of talking to them and building their capacity to manage their own water points. So we've worked with Narok County. We are now working with Turkana County, especially trying to introduce water governance for small rural communities to also manage and to operate their waters sustainably. So we part of the work that we do is infrastructure. So it's toilets, building toilets, and we've seen in these geographies they have loose soils, and most of the time, a case in example is there are toilets that have been built in schools, and this so you invest so much money, but within no time these toilets are collapse because of the rains. So when there's flash floods, then the toilets are collapsing. So so what we've done is we work with our engineers to design pits, so doing pit lining and pit reinforcement to ensure that the risk of collapse are mitigated or prevented in a way. And of course, toilets are expensive to build, and not only expensive. We've seen practical examples where communities always revert back to open defecation. So once we do that, we train the local masons and artisans, we call them fundis, to also work on such kind of technologies. So these, most of the time we see them being replicated in households, and people are investing money on solutions that will not be washed away every rainy season. Something else that we also do is, Saskia mentioned issues around remote water monitoring. So we also now do the water quality monitoring, and we've installed sensors in, now we have 20 boreholes, and these boreholes, we collect data on different seasonalities. We've seen situations where during dry season, salinity levels go up. So we try and start now managing and of course telling the community to try and slow down the abstraction. We've seen situations during extreme rainy seasons where things like ion levels increase, turbidity increase. So we try and do this and monitor these waters, and of course provide that data to the local government, and of course the water management committees, and through that try and do early warning systems. We don't do it very well yet because we are not water quality experts, and most of the time our intervention is provide more water, because this is what is needed mostly. But these are things that now we are learning through and trying to see how to respond to water quality issues in different seasonalities. So yeah, so that is it for me. Thank you so much.
All right, thank you so much for those great presentations. If there's urgent questions, I think we have room for one or two, but otherwise our speakers will join you for the next part of the session as well. So I would encourage you to continue the discussion when you're working on working in groups through the game. What is it?
Questions?
I don't see any online questions either. All right, let's do this here, one question in front. Yeah.
Hi, thank you. My name is Alicia from Cranfield University. Dennis, I wanted to first understand what is it with the fence. I think I didn't catch that. And secondly, I would like our presenters to reflect on the kind of emerging governance issues that may come with, implementing climate and resilient infrastructure. So, for instance, I see the boreholes, the elevated latrines, the amount of money that goes into developing these latrines. What sorts of challenges in terms of governance do you think that might present at the same time? Thank you.
Yes, so I'll talk about the fencing. So it's part of some of the things that we learned from WHO, is that whenever you have a community managed, a communal water point, yeah? So you try and do protection. So one, of course, so that people don't steal or damage the solar, but also the bowl itself can be, because it's a hole, eh? So it can be contaminated. Eh? So we fence it and put in a lock and air padlock just for water safety planning. Eh? So when it comes to the issue around the toilets and of course the raised and building it from, so it's expensive in a way. Eh? But then you find that you don't wash away money whenever it floods. So we are working with, we've seen governments now adapting such kind of engineering, bringing in solid engineering, so that when you construct something that will last and it's durable and will serve communities for years and years, rather than just investing in a technology, and then within 6 months, we've seen even sometimes within 3 months, and then toilets are collapsing.
Yeah, that was a great answer, so I won't expand much more upon it, but I think that there's the two pieces, the getting something installed correctly in the first place. I think there's a lot of governance challenges around that, who's doing installation and what kind of checks and balances are there that it's being installed properly. But then, of course, after it's installed, also taking care of it, and so having an institutional structure in place that means there's capacity to do that. And often some of the big challenges are around supply chains and procurement of replacement parts and all of these challenges that we've seen just looking at doing safely managed water and sanitation, but now bringing this climate resilience layer on top of that. I think it's important we don't fall into that same thinking that infrastructure alone and durability alone is going to get us there, but really the need for ongoing operation and maintenance, and how are we going to make that workable.
All right, thanks. We're going to make groups. I did see one question there in the back, so I hope you can find each other during the next part of the session, and that would be great. It's pretty straightforward. We need 4 groups, about 10 people each, so it's good that some people left early, so I think it makes it easier to do this next part. It's a card game. You each get an effect of climate change that you will be working on, and then working from that effect, you think about which hazardous events can occur, which measures can we take to address these events, how do we monitor the impacts, and then finally which policy actions can we actually develop and implement. Our group members will be joining you in your little groups, so they will help you to get it started and to explain you through it. I think we'll go play for about 15 minutes, and then we'll be back for a little plenary feedback from each group. So thank you very much.
Yes, sorry, I was just trying to get the name. Yeah. Because I'm sure you get Jesse. Oh, Jesse.
Yeah, I made an attempt.
Maybe we're going to focus each one.
So you want me to facilitate?
All right, just a quick heads up. So the panelists have each game card pack. They're going to come and join you and try and make 4 groups. So if you just keep an eye out for them and join a group yourselves, then we'll get started.
Yes.
I'm not sure, but there are like categories of cards.
Yeah, so we need the purple cards first. So we're going to choose a climate change effect to kind of focus on for our discussion. And the options are increased temperature, drought, sea level rise, flooding, heavy rainfall, or decreased temperature. So does anyone have a strong preference?
Yeah, I think maybe before you do even think of the context where you want to share.
Oh, choose a context.
Yeah, like is it are we in what kind of climate zone? Is it urban? Is it coastal? I think.
Yeah, that makes sense.
And choose and
then
makes
you
it a
can
bit
pick a
more
habit. So does anyone have a context where you want to say somewhere we recently?
Luckily, I'm not coming here.
Okay, so we're in Turkana County. And what climate change effects? I mean, first of all, does everyone
Can you read that again and we can think?
Yeah.
What were the
Does everyone in the group have a sense of what we mean when we say we're Does anyone need more? We're all nodding. Okay, so.
Narrative. Pessimists, pretty rural, apart from the whole target. So small urban centers, pretty far away from coast, pretty far away from big towns.
It's a globally recognized
Traditional community.
The poorest or what? Or very close to the poorest?
Yeah, so, and it's a very large county. This county is one of the largest counties, apart from Mozambique, I think one of the largest counties in Kenya. And it borders with South Sudan and Uganda. Has a lake, Lake Ghana, but that is very, I think they don't apply it for drinking water. So mainly the drinking water is coming from the river, from boreholes next to the river, because there's of course subsurface water. And then there's a big refugee camp in Kuma that hosts refugees from Congo, Sudan, Ethiopia, Eritrea, Rwanda, who would be a mixture of people.
Yeah, and so when it comes to the climate, I guess it's like bigger, it's extreme severe drought challenges, but then also just coupled with severe flooding challenges.
Increasingly, yeah.
Increasingly, these flooding. So the climate change effects we can talk about were increased temperature, drought, sea level rise, not relevant unless we want to get very creative, flooding, heavy rainfall, or decreased temperature.
So I heard that some
Yeah, so these are the heavy rainfall. Or
I can imagine, but what do we think the difference is between heavy rainfall and flooding?
Heavy rainfall.
the offset of your
I mean, I think part of also what Dennis is saying is that some of the flooding isn't actually from rainfall happening into climate, it's happening upstream.
Yes.
So perhaps flooding that issues flooding is.
Sure, yeah.
Let's keep our life circular. Okay, so then we were talking about hazardous events related to flooding.
I think there's a. So should go ahead. We'll show them to the people.
Yeah, so basically these are the full set of hazardous events that might apply to any of the effects. We're choosing what's going to be the most relevant for the flooding. And there is an answer key, but we're told we need to be creative. There are multiple selected.
That's right.
Yeah.
Publishing in the UK as well.
So discharge of contaminants into the wide sewer overflows due to heavy rainfall. So I think the CSO specifically is less applicable to Ghana because they have that level of sewage locations, but I mean the idea is consistent. Sanitation challenge.
But again, you do of course have then overflows of septic tanks and others.
Yeah.
It's not a sewage system because there is no the main of the sewage pipeline. And you do have septic tanks that flow into the flood, and then you have the same population on the street.
There isn't a septic tank, so there's actually this game that feels a bit biased towards a sewage context.
Or you could say that the sewer is like a concept under which septic tanks or trees or leach pits could also be included.
I mean, there's one on interrupted drinking water treatment, but I wonder how much drinking water treatment there is in Ghana.
That's what you're saying. Like that's why you select the source water. So your source water gets polluted because if your sewer overflows, then the next thing that happens is your borehole then fills up and there's water. And now your source, so your boreholes are being and then erosion. And this one is
So interestingly, in the answer keys, the source water gets polluted associated with heavy rainfall, but not with flooding. So I wonder what the logic was behind doing that. And that would lead to flooding issues.
There's just mentioned runoff as a big keyword, so they might be thinking more rainfall runoff, which is
What else is flooding if not excessive runoff?
And there's like agricultural runoff as well, which is going to maybe one more.
Yeah. So we would perhaps, I think it's very valid to keep it that way.
yeah, sure. Yeah, because it gives the rainfall.
Yeah. So we go.
Increase of increased presence
Yes, I'm sitting this side, it's quite difficult to read.
Yeah, I think that one is interesting, the increased presence of pathogens, because isn't that there are more pathogens or that they're just spread around? Because increased temperature is the one that they've associated with the idea that your environment turns into how much is there. Yeah. Yeah. Yeah, so there's is definitely the location of where your pathogens are showing up is changing. But are there actually more pathogens? Like, are they
in the borehole, yes. In the borehole,
yeah.
it's not fine.
Yeah.
Geologist.
Yeah, it's not where they're spreading to, but they're not necessarily that they're all replicating more quickly or growing more.
But I mean, that's a bit of a philosophical question about like, are we happy to all pathogens concentrated on penetrating? Yes, we are.
Absolutely, I think it's just like a nuance of why they put it beside increased temperature, because I think the key thing with that is if you had the flooding and heat wave together, then you would be in additional trouble. It's not because the pathogens are spreading everywhere, but they're also producing at a much faster rate.
But they get more access to potential access to good nutrients that they need to go.
Yeah, exactly.
The presence of pathogens can be the density of pathogens within a certain area, or the spread. So there's a little bit of exactly worse.
And with the flooding means they can't access the boreholes pump, right? Household, or is it
It's a community, so maybe a couple of cases, depending on where the community is settled and where they're coming from. This is where they're.
So they might have enough. They might not be able to access the supply. Preventing
Yeah, certainly if it's a generator that somebody needs to operate it with a generator, and you need to go there and you can't access the tank, or it's washed away. So this is the worst situation is broken.
So is there anything here that allows us to capture that hazard of the water point is just washed away?
there was erosion to it. You had a card that said erosion, but
In other places,
yeah, there we go.
Yeah, I mean erosion, but that's pollution of the source water. Like you've lost your entire borehole.
Yeah, but then you get referred back to surface water. So then the source water, the source is different, but it's still source water. Either I use water from the borehole, if there's no borehole, I will go back to my shallow duck well or something else. And then water is now, is of course, it hasn't been better. So my source water is now polluted because it's not that you use the same source, but it's always source water.
Yeah, I think that once the flooding recedes, you've lost your surface water and then you've lost your access to groundwater as well. So that creates a big scarcity.
Well, or a quality issue because you will still, I mean, not drinking water is no option. So you will drink water, but that water will be of a lower quality than the borehole that is washed away. So you will have water from
That's the thing.
Because yeah, but if it's all, but that's the problem with Turkana. There's not that with the Turkey case, there's not a community with very low density and low populated areas. So it's either the borehole or the river that you drink from, and there's not any issue.
So this is a context where we are talking about people will die, but there's...
Yeah, so they won't die. I mean, they won't die, they get sick because they will take the water out of the river.
So we need a treatment. Sand dam. Bring in the sand dam.
There is no...
There may not be an option in this part of the drought for everyone. Like they may not find water anyway.
Like we've got 3 minutes.
So this is the other one that I think quite interesting. This is the other one that's chosen for this, which is about interrupting with treatment, which again is I think reflecting that it's a more of a European Okay, so
Do you want the scarcity? Is there a scarcity one? Because we're talking about the variability of rainfall influencing flooding. But you were just highlighting there is a scarcity issue at different points in the season. So
it depends a bit on whether the borehole, the severity of the damage. If it's only, it can be only the pollution of the borehole and the borehole still functional, or it's washed away and non-functional borehole. Then you can hear it.
I think drinking water would justify it either way. So if we put it in there, because it's two sides of the same coin.
To criticise the game again, I mean that one is almost applicable, that more water quantity available is reduced, but then it's also about freezing at the end, so well, clearly not. But But if it hadn't said freezing, it would be right. Surely you should. Surely the point of this stage of the game is to separate out the cause from the effects. Yeah. What should we go into control measures?
Yeah, so possible control measures are the blue cards. So if we maybe a lot to read, but I think we can also so I think if we're
thinking, I don't know if you kind of like what in macaroni. I'm kind of thinking macaroni, and I'm like, some of these are ridiculous.
do we want to maybe just choose one and then think about control measures?
Yeah, it's fine. So that we have
Additional drinking water treatment, like, well, starting off with some drinking water treatment. Let's have some of those osmosis. It's just not very.
Has they got any money? No money.
Develop additional or alternative sources for drinking water.
Miles, yeah. You prefer Lizzie?
Yeah, okay, so that one's really good for the scarcity issues as well. Consumers on water use probably not very
It's not about making sure that this borehole is some kind of flood resistant.
No way.
So this one,
I'm volunteering you to talk to someone about sanitation.
Oh, sorry.
I sorted it out.
Good, thank you.
So if we're talking about, yeah, this issue of sanitation.
This is the, I think the one we're meant to put with it, but it doesn't really work in Sakala.
Well, that's done.
Yeah, okay. The answer is CSOs in Sakala, yes.
Hey, but so making one borehole kind of flood resistant, that's possible. But making all of your septic tanks and leach pits and latrines flood resistant, it's very hard.
And it's, yeah, actually, Europe is looking at that, right?
Yeah.
So is it then more about actually thinking about the protection measures for where you would settle this?
Yeah, I mean, ideally, yeah, you think landscaping and making sure that floods, where to go around, that's cheaper than elevating all of the latrines within the community. But it's still very...
For that community, the catchment for that community, you can't flood protect the entire catchment.
So a lot of the...
Yeah, I was thinking that, but in this case, I would say that this such a contaminants through the overflow is really a urban period problem. So maybe when it's one latrine or one household or households. Yeah, it's bad, but I mean, the damage done there is less. I mean, it's not nice to hear if you're living in that household, but that's still. So let's get these all apart.
We have some feedback, but I'll share with you. Yeah, CDC. So Emily introduced you again to my office.
I don't know which one.
We're talking about overflowing, or not sewage, but all these individual
Sorry, that's
Who is this game? So to take a little bit of an umbrella, it is quite interesting. So who's it aimed at? When whoever WHO developed this game?
No, actually, I'm with this is not my, I'm with South Africa. That's okay.
Okay, so who was it aimed at?
I imagine it's aimed more for policy makers.
policymakers in the European context. So like sort of city level policymakers.
So municipalities did
I did a very similar study in cities like and stuff. We actually, we kind of came up with this kind of table. So I'm like, oh, I never occurred to me. It never occurred to me. But so I could do it, but it would help to do it. And when it helps us. Assumptions being made.
That's why, sorry, I kept them out. That's why this game has wild cards. Sorry. So you can say, you can also say, I'm using a wild card, like in this case, for example, maybe my wild card is think about landscaping to maybe next year, maybe not all the flooding, but maybe half the flooding that happens.
All right, thank you everyone. It's past 10, so we have to close the session and leave the room for the next speakers as well. I've had some great discussions in our group. I hope you had a good time playing this game. If you have any feedback for us regarding the game or just want to continue the discussion about the subject, we'll be in the main room afterwards. Thank you all very much for joining, and I'll hope to talk to you later. Bye-bye.
Thanks.